8 signs your body gives a month before a heart attack. The American Heart Association says that more than 90 million Americans suffer from various heart diseases, and about 805,000 of those suffer from heart attack yearly. Although most heart diseases are genetic and there's not much you can do to cure them, heart attacks in particular can be prevented. To do this, you must pay attention to your body and look out for the signs that indicate an imminent heart attack. In today's video, we'll be identifying 8 signs that your body will give you a month before a heart attack. Number 8, fatigue. Fatigue is one of the most common symptoms of heart attacks, but it's quite tricky because everyone gets tired from time to time. However, there is a way to tell if the fatigue you're experiencing is a symptom of an impending heart attack or simply normal tiredness. If you notice that you get tired easily for no apparent reason, this could be a telltale sign of an imminent heart attack. Oftentimes, this type of fatigue is combined with other symptoms of heart attack, such as chest pain, jaw pain, or dizziness. So before you get worried about any fatigue you might be currently feeling, check if you're experiencing other heart attack-related symptoms first. According to the National Heart, Blood, and Lung Institute, fatigue as an early sign of heart attack is more prominent in women. Heart attack-related fatigue is caused by a reduced blood flow to your heart. This is often caused by a buildup of plaque in the blood vessels, and it obstructs the flow of blood. It is for this reason that we are encouraged to eat healthy and steer clear of foods containing substances like cholesterol that can block the arteries and veins. Number 7, jaw pain. According to the Cleveland Clinic, it has been reported that women may feel pain that is specific to the left lower side of the jaw around a month before a heart attack. As is the case with fatigue, experiencing jaw pain as a lone symptom is not enough to worry about a possible heart attack. Usually, this jaw pain is accompanied by other symptoms like fatigue, unusual perspiration, shortness of breath, or discomfort in the chest, shoulders, or neck. Here's a quick test you can take to ascertain if any jaw pain you might be feeling could be related to a heart attack. Try to move your jaw around for a bit. Usually, if doing this increases the pain you're feeling, then your jaw pain is more likely to be related to a dental problem. In that case, you can rest a bit easier. On the other hand, if the jaw pain does not change in intensity when you move your jaw around, and you are feeling other symptoms like those we have previously mentioned, then you might want to speak with your doctor. Number 6, abdominal pain. In about 50% of heart attack cases, abdominal pain has been reported as a prior symptom. Stomach nausea, the feeling of being bloated, and indigestion can be indicators of a future heart attack. As always, these symptoms are often accompanying one another. While indigestion on its own isn't worried, if accompanied by nausea or sweating, this might be indicative of an impending heart attack, considering that these symptoms usually do not come with indigestion. However, if you are feeling a burning sensation in the back of your throat while you're suffering from indigestion, then it is most likely not a symptom of a heart attack. In such cases, you should try to treat yourself for those symptoms, and if the symptoms are cured, then it is unlikely that a possible heart attack is the cause of your indigestion. Abdominal pain is sometimes accompanied by the upper body pains like pain in your arms, shoulders, neck, and back. You might have noticed that in many movies, heart attack victims are seen clutching their left arms during an attack. This is true to life. Sometimes this pain is very mild, that you almost don't think it means anything. But if left unattended, this can lead to a full-blown heart attack. Number 5, dizziness. Right before a heart attack occurs, it is common for many sufferers to encounter a period of dizziness. This does not happen only just before the heart attack. Weeks before the attack, your body will undergo periods of dizziness or lightheadedness. When your heart struggles to pump enough oxygenated blood around your body, your brain is starved of both blood supply and oxygen, which results in dizziness and cold sweats. If you're also suffering from other heart attack-related symptoms, dizziness is an ominous sign that a heart attack is on its way. Long before the heart attacks happen, you might experience short stints of dizziness that you might not even take seriously. But if the frequency and lengths of these dizzying spells is increasing over time, then you must pay attention to it and see a doctor. Number 4, shortness of breath. When your heart struggles to provide enough blood to your lungs become inefficient. This inefficient performance of the lungs manifests as shortness of breath. As your lungs become starved of blood, drawing in and breathing out air becomes more difficult. Shortness of breath has been diagnosed in up to 40% of heart attack cases, which makes it quite a common symptom of heart attacks. Also known as dyspnea, it can be described as a strong feeling of difficulty during an attempt to draw a deep breath. It can also be described as a feeling of constant need to take in a deep and long breaths, even if you are not finding difficulty doing so. Other times, you might find your breathing speeding up while your breaths remain shallow. Shortness of breath is a great warning sign of a heart attack, as it can occur as early as up to 6 months before the attack. One tricky thing about this symptom is that it can show up without any accompanying chest pain, so it appears very harmless. However, if you find out that you are increasingly getting out of breath in situations where you normally would have no issues, then you might want to check out with your doctor. If you're already feeling the shortness of breath along with chest pain and other symptoms of a heart attack, go see a doctor today because a heart attack is on its way. Number 3. Excessive sweating. This condition is medically known as diaphoresis. Sweating is normally caused by an overactivation of the sympathetic nervous system. Typically, when your blood pressure and heart rate go up, you sweat. This type of sweating is often accompanied by clammy palms. However, if you find yourself sweating profusely for no obvious reason, then it is time to pick up the phone and fix an appointment with your doctor. Excessive perspiration is usually accompanied by flu-like symptoms and clammy skin. When linked with heart attacks, this type of sweating is usually more prominent at night, leaving your bedsheets dampened by sweat. Unexplainable sweating is often one of the most troubling symptoms for people who have suffered a heart attack. In fact, they are more likely to call for help when they are experiencing unusual sweating than when they suffer from any other symptom of a heart attack. Like most of the other symptoms on this list, excessive sweating is more worrying when accompanied by other symptoms, and if you typically do not sweat a lot. It is important that one pays attention to sweating as a prominent symptom of a heart attack, especially older women. Older women are likely to dismiss excessive sweating as a sign of menopause due to the hot flashes, but this can be misleading and ultimately fatal. Number 2. Increased heart rate or irregular heartbeat. When your heart rate or pulse speeds up, it is a clear indicator that your heart is doing more work than it normally does. Now, this is normal when you are doing challenging tasks. If you are exerting yourself through some strenuous activity, then it is normal for your pulse to be high. The problem is when this happens when you are relatively inactive or long after you are done with exercising. This can be a very worrying sign. It indicates that your heart is having trouble pumping blood around your body and is therefore overworking itself. Many times, just before a heart attack takes place, an increased heart rate is the ultimate red flag. However, even long before the heart attack, your body is likely to experience an increased heart rate, which is also called tachycardia. Sometimes an irregular heartbeat or arrhythmia can be a danger sign in some people. Irregular heartbeat or skipped heartbeats often come with a panic attack or a strong feeling of anxiety. It usually lasts for about 1 to 2 minutes and can also be accompanied by extreme dizziness or fatigue. If this ever happens, it is very vital that you call your doctor immediately, as it is a major sign of an imminent heart attack. It is worth noting that people who are susceptible to high blood pressure or have struggled with high cholesterol levels in their bloodstream are highly prone to experiencing increased heart rates and to suffer from irregular heartbeats. However, if these symptoms occur alongside other typical heart attack symptoms, it is a clear pointer to a possible heart attack. Number 1. Chest pain. In many depictions of a person suffering from a heart attack, a prominent feature is that they often clutch their chests, indicating the intense amount of pain they feel during the attack. Long before the actual heart attack, it is very likely that a person suffers from periodic chest pain. This is very common with men. In fact, in men, chest pain is considered one of the most important early signs of an impending heart attack. For no reason should any form of chest pain be ignored. Usually, when chest pains occur as an early symptom of a heart attack, it is much milder than it is perceived to be. Because of this, many people allow it to pass and they consider it to be nothing. The result of such negligence could be fatal in the long term. It can result in irreversible damage to the heart, a consequence which could have been averted if it was properly attended to. If you experience any severe pain in your chest at any time, you need to see a doctor immediately. If you experience any tightness, aching, burning sensation, or squeezing in your chest for a minute or two, try sitting down or resting for a while. If that doesn't cause the pain to subside, you need to see your doctor immediately. You can avoid a debilitating heart attack if you take good care of your body and pay proper attention to it. Ultimately, eat healthy, exercise often, see your doctor as frequently as required, and you could save yourself from ever suffering a heart attack. Thank you very much for watching. Catch you guys in the next video. Comment down below your thoughts, give this a like, share with your friends, and don't forget to hit the subscribe button and notification bell to keep you updated for more interesting facts, tips, and ideas from Smartville.